Hello everyone. Today we are going to learn about pre-menopause. For that, we need to know what is menopause. So, menopause is a stage of a menstruator's life where the periods stop completely. This involves a lot of transition, which is why it is important to know about premenopause. So premenopause can be a phase of extending of 2 to 3 years prior to your menopause, and the transition to menopause can include numerous symptoms like you can have some menstrual irregularities. So if you have had regular cycles prior to this, you can experience some delay in your periods or some frequent periods as well. There can be some increase and decrease in the flow of periods. You can experience some passage of clots or maybe pain during periods. You can experience some mood swings, some hot flashes, some frequent urinary infection or urinary burning, recurrent vaginitis or vaginal discharge, very fatigue or weakness experience. It can also involve a lot of bone loss, or you can experience too much joint pain. So why are you going to experience all of this? Do all women experience all these symptoms? So the answer is many of the women experience these symptoms prior to reaching menopause. Why? Because there is hormonal transition which is going on in your body, which makes it difficult for the body to maintain the regularity of the cycles, which is why the cycles can become a little irregular. If it is hurting you a lot, then you should obviously go and meet a gynecologist, confirm the diagnosis. Sometimes there can be an underlying pathology and we should not be missing it out. The hormonal transition can also affect your mood, your bones, your temperature, your cardiac system, everything. So which is why it is very important that you take care of all of that if you're experiencing all of those symptoms. How is it possible to reduce all of the symptoms? So I'll tell you some tips. Number one is, if you are experiencing any of these activities, make sure that you visit a gynecologist, confirm that there is no underlying pathology. Your uterus is normal, your ovaries are normal, there is no any pathology in your uterus and your ovaries, etc. Second point is, make sure that you are maintaining a healthy lifestyle, by which I mean that you are taking a healthy diet, doing regular exercises which will help maintain your bones stronger. Also, it will help to regularize the hormonal imbalance which is occurring in our body. It is also important to supplement yourself with calcium and vitamin D if that is low, because after menopause, there is a very high chance that the calcium and vitamin D become low and it can affect your bones adversely. Third thing is, if you're experiencing recurrent vaginitis, recurrent urine infections, make sure that you're getting yourself checked. By which I mean that you go to a gynecologist, get yourself examined, and if necessary, some necessary blood tests like maybe urine examination or pap smear can also be done to actually understand if there is underlying infection, or is it because of the hormonal imbalance. If you're experiencing extreme mood swings, make sure that you talk to your doctor about it, because that can also be taken care of during this phase. So the last message which I want you all to take away from this is that the phase towards menopause can be difficult as the menopause as well. So if you take care of yourself, your body, your hormones during this phase, you're not going to experience much of a difference while attaining menopause, and then you can maintain a very healthy body and a very healthy mind. It is important you identify this phase and you just go to a doctor and talk to all of these things. Happy healing!